Dr. Arti Bhasme, consulting dermatologist and trichologist, practicing at my own clinic, Summer Specialty Clinic at Kharadi, Pune. In my daily practice, I see various kind of patients having different kind of skin and hair disorder. Today, we'll discuss about a very important and very common issue faced by almost everyone in some phase of our life, that is hair loss. If you ask anybody, definitely they might have hair issues at some phase of their life. Hair fall is very distressing to the patient. A woman is considered to have her hair as her crowning glory. It's just not females, but males are also nowadays equally concerned about their hair health. So let's see what are the various factors which cause hair loss. Hair loss is multifactorial problem. First important factor which affects the hair health is diet. For a good hair growth, we have to have a diet which should be rich in protein, iron, calcium, vitamin B12 and D3. Any micronutrient or macronutrient deficiency can lead to hair loss in the long run. Patients may experience dry, brittle hair, very weak hair, which easily get tangled and break on normal combing. So this kind of hair loss, if detected at an early phase, definitely we can halt the progression of the hair loss, and regrowth of the hair is also possible if proper deficiency is properly diagnosed. Second most important cause of hair loss is stress. It could be mental stress or physical stress. Nowadays, in today's fast-paced life, causes of mental stress are increasing. Patient may experience mental stress because of their daily office work. It could be students experiencing stress because of their increasing study pressure, or there could be other reasons also. Mental stress definitely takes a toll on your hair health. For achieving mental stress, definitely some meditation, some yoga is essential, and taking in your day-to-day life, you should definitely keep aside some 15-20 minutes for yourself to for your proper health of your body. Physical stress can definitely affect the hair. Physical stress is could be excessive physical work, or majorly physical stress affects the hair after certain major surgeries or major illness like typhoid, malaria, and COVID. After such major illnesses, the body undergoes weakness and all, and that affects the hair health. We may see many patients experiencing hair loss after 2 to 3 months of such major surgeries or major illness. Third most important cause of hair loss is hormones. Hormones play a role in your hair health in both males and females. Female patients may experience hair loss in thyroid disorders and in a condition called as PCOD, that is polycystic ovarian disease. In thyroid disorders, females may experience hair loss. They may encounter the hair has become dry, brittle, and eventually it breaks easily. In cases of PCOD, in which the sex hormones are dysregulated, patients experience gradual miniaturization of hair, that is, gradual thinning of hair. This kind of hair loss, if diagnosed at an early phase, can definitely be halted. But if diagnosed at a late stage, sometimes it is not reversible. So we can we can halt the progression of such hair loss. We can improve the hair quality, but if it has progressed to very advanced stage, sometimes it is not reversible. In male patients, androgenic alopecia, or it is also called as pattern alopecia, is a major cause of hormonal hair loss. In such cases, there is receding hairline, that is the frontal and parietal region. They experience the hair starts gets thinning. The hair follicles are become thin and brittle, and eventually the hair loss happens. This kind of hair loss also is irreversible. At early stage, if diagnosed by consulting a good dermatologist, we can halt the progression of such hair loss. But if it has advanced to a very advanced stage, grade 3 or grade 5, then in such cases, reversal is not possible. Definitely, there are certain therapies to correct the hair loss that we'll discuss in the end. And lastly, chemical treatments of the hair. There are different chemical treatments nowadays people undergo. There is a increasing trend to undergo straightening of the hair, hair coloring, keratin treatment. Such kind of hair treatments repeatedly can take a toll on your hair. Your hair may become brittle, the hair follicle tends to get damaged, the protein bonds of the hair are damaged and they break easily, and it can lead to hair loss. After such chemical treatments, there is a specific hair care which should be followed to keep the hair healthy. But sometimes, if such hair care is not taken, or if sometimes the procedure itself has not been done properly, then the patients may experience hair loss. So now that we have discussed the major causes of hair loss, let's now turn about the treatment. See, normal tendency of people after they experience hair loss is like they take advice from friends or even from medical shop people or even from parlors what to do about this hair loss. They try different kind of shampoos, oils that they encounter on the social media. In such process, the precious time is lost. They approach the dermatologist at the right time, as previously discussed. Also, we definitely can halt the progression of the hair loss, and in some certain cases of hair loss, the hair fat can be recovered back also. But when they keep on trying out different oils and shampoos, sometimes they don't get at all any good results. But in that process, they may damage their hair more. So it is very crucial to consult a certified and qualified dermatologist at the right time. When you consult us, firstly we examine your scalp health and your hair follicle quality. Accordingly, we take your history, what could be the different reasons of your hair loss. If required, we may advise you for certain blood tests to assess any nutrient deficiency. After getting the reports and after checking your scalp, we come on a diagnosis, and accordingly we advise you some oral medication. Oral medication mostly are biotin containing multivitamins which contain selenium, chromium, iron and other micronutrients which are essential for hair growth. Such tablets may be prescribed for minimum 3 to 6 months or more depending on the reason of the hair loss. Secondly, we advise some topical lotions. Topical lotions could be some peptide containing serums, some minoxidil containing formulations which are good for recovering your hair loss reasons. So, apart from this, we advise you majorly about your hair care, which is most important. You may take treatment from the dermatologist for maybe 3 months or 6 months, but later on also, if you don't take proper hair care later on, the hair loss can come back. So the most important factor, as we previously discussed, that diet should be taken care of. So you need to take a good diet rich in protein and iron. For protein, you may take, if you are non-vegetarian, you may take eggs, chicken, fish. For a vegetarian also, you may consume dairy products like milk, dahi, buttermilk. Then protein containing legumes are important. You may take sprouts in your diet. So this will take care of the protein requirement of the body. Sometimes in extreme cases, we may advise you protein supplements also if they are required. For iron supplements, firstly, yes, definitely correction in the diet is important. Take green leafy vegetables. You may consume more of your carrots, beetroot to increase the iron intake. You may cook food in the iron vessels also, which increases the iron content of your diet. You may use iron supplements if your iron levels are very low, like after assessing your blood test, if the hemoglobin content is low or if the ferritin stores are low, we may advise you iron supplements as per your blood levels. Then, after correcting the diet, your day-to-day lifestyle also needs to be modified. Taking adequate proper sleep, avoiding stress, as previously advised, you may do meditation, yoga to keep yourself stress-free. These factors are very much important in today's life, and definitely after doing this, you will experience improvement in your overall body health and hair health. Then, thirdly, taking proper hair care. Hair care means using a proper shampoo, conditioner, using the proper oil, and avoiding external factors, external chemicals. As far as the shampoo is concerned, after examining your hair, we advise you appropriate shampoo. For just daily cleansing, sulfate-free or paraben-free shampoos are essential. Any paraben-free shampoo or sulfate-free shampoo are mild on the hair and they retain moisture of the hair. If the hair becomes more dry, the hair breakage is more. If a patient is experiencing dandruff, we may advise you appropriate dandruff controlling shampoo. If you are experiencing hair loss, then there are proper anti-hair loss shampoo which may contain additives like caffeine, alpacin, which will improve the blood circulation of the hair and it will prevent the hair loss. After hair shampoo, conditioner is also very much important. Conditioner helps to retain the moisture in the hair. It will prevent the hair from becoming dry. Not only people with dry, brittle hair or curly hair, normal hair also, people with normal hair also require conditioner post shampoo. This will keep your hair shiny and soft and prevent hair breakage. Then later on, after this, whenever you are going out, as you are like we all know, sunscreen is essential to take proper skin care to protect your skin from sun damage. Similarly, covering your hair to prevent damage from the hair, damage from the sun to your hair is also very much important. You may tie a scarf if you are going out in the sun. There are certain hair serums also available which contain SPF, that is sun protection factor, so which will prevent damage to the hair from the sun. So these are day-to-day hair care practices we should follow to prevent hair fall in the long run. Then after all this, there are certain hair treatments also that we may advise if required. Firstly, important in that is platelet-rich plasma therapy. Platelet-rich plasma therapy, it is nowadays very common therapy done for hair loss treatment, in which we take patient's own blood. It is processed in a centrifuge and the platelet-rich plasma is separated by a technique, and this platelet-rich plasma is injected into the scalp of the patient with the help of small insulin syringes. In this, we give growth factors to the hair which will improve the hair quality. Second treatment is mesotherapy, in which certain improving meso cocktails are there which are injected in the scalp. This also helps in preventing hair loss and improving the hair quality. Third important treatment advice, mostly it is advised in advanced cases of hair loss in male patients or female patients experiencing androgenic alopecia. If there is very advanced grade hair loss in which the hair cannot be recovered back, transplant is done wherein the hair from the back side of the scalp is transplanted on the front side of the hair. This is a long procedure. Patient needs proper counseling. Patient needs proper treatment of the scalp prior to undergoing hair transplant. So I think we have discussed the main important factors now causing hair loss. What treatments are advisable to you with which we can prevent hair loss? If any more queries, you can always reach to us at our clinic or you can reach to us on social media also.